State Representative Tarah Toohil is calling the State Department of Health to release more detailed numbers when it comes to kids and COVID-19. Our Janine Lassand spoke to her about that topic and more.
Yes, so what we were seeing locally in our hospital here is that if children did get the coronavirus, that they actually had it from their family. So it would be another family member was getting tested and the child would end up getting tested. It wasn't because the child was falling ill and had to get hospitalized. So we aren't seeing severe cases right now in children. But I mean, they've been locked in their homes for 5 months now, and they're going to be susceptible to a lot of different germs, bacteria, and other types of viruses because doctors are telling us our immunity is pretty low because we haven't been exposed to a lot. So we haven't been building up our immunity. There were concerns about whether children are transmitting the virus, if they could give it to their teacher. So right now we are still having children wear masks when they are in school. And, we're just trying to get as much information from the government right now, from the Department of Health, so that people aren't so scared when they say there are 5 children that have tested positive. It might mean that those children are completely asymptomatic and that they are treatable with a Z-Pak, azithromycin, and zinc, and certain vitamins. And that's what a lot of these treatments have been. So the cases seem to be less severe.
What are we looking for in the numbers when it comes to children, when it comes to, I know when we get the report, it's broken down into age brackets. What does that specifically mean?
So there hasn't been a lot of clarity in the numbers that they provide us. So usually it'll say from ages 18 and under, the number is 0, or children 3 and under, the number is 0, or a non-reportable number. And we're asking them just be more correct in this number. If it was 1 person in May and now it's 4 people in July, just give us the number, give us the breakdown. What was the age? How do you think this child got the coronavirus? Was it family spread? Was it international travel? And just give us as much information as possible. And then also give us the positive information that people are not currently being hospitalized, and that when people are getting COVID-19, that they're recovering quickly and that they're not having lasting impacts. And we just want accountability and clarity and as much communication from the Department of Health as possible. We don't want to just have 5 cases of coronavirus with very, like the children could be completely asymptomatic and were just tested because they were going in for a surgery or were, had a family member that was also sick, and that the children are largely asymptomatic. We don't want to just shut down schools because of that. If we're going to be able to try to acclimate to this new normal and also lessen the spread, we do want to get our children educated. And a lot of children, the safest place for them to be is in a school because of other human services issues that we're having in our communities now.
And finally, just to clear up any rumors, even if you're tested maybe to go back into the nursing home, if they're testing you 4 or 5 times each day, is that counting as actually 5 cases of corona?
So that's a great point. What we did find out last week was that if you have a nursing home resident who then goes into the hospital, they will test that resident every day. So say it takes 7 days, they keep testing them until they are no longer positive. So if John Smith gets tested 7 days in a row, it will show up as 7 different coronavirus cases, when really it's just that one initial case. So John Smith can then be tested, and if he's not clear of the coronavirus until day 8, he's shown up as those 7 extra tests. So our numbers are artificially inflated in that way. And that's something that, we want people to be safe, stay socially distant, still, don't be shaking hands, don't be touching your face without washing your hands. We want to do what we're being told by CDC guidelines, but we also want people to still have interaction with other human beings, because we're having a lot of side effects from this lockdown that's almost 180 days now of lockdown. And it's been a lot for people mentally, and people feel isolated, and we have all these other societal problems that are coming in because of this coronavirus and COVID-19 crisis.
Thank you, Janine. Tarah Toohil will be facing Democratic challenger Todd Aegis in the general election. SSPTV has reached out to both candidates. We'll be holding a debate on October 22nd. Toohil has accepted the invitation, and we're waiting on a response from Aegis.